Friends, are back with a new session here. In the previous lecture, we have discussed about some cardiovascular system changes in the pregnancy. Continuing that lecture, we'll discuss here some heart diseases in pregnancy. So let's start it. There are some indicators which represents some heart diseases abnormality in the from the changes of pregnancy, the normal changes. Okay, so the indicators are increased JVP. Okay, so there is increased JVP here, which is normal and unaffected during pregnancy, but it is abnormal if it is increased. In the heart sounds, you have learned that S1, S2, S3. S3 is easily heard during pregnancy. So, and S1 is wide with wide prominent split and heard loud. S2 is normal. So here in abnormal things, the S2 sound will be loud, and there is prominent split in S2, and S4 can be easily heard in the in this heart diseases problem. Okay, and the ejection systolic murmur is prominent, and it is and a diastolic murmur is also heard. Okay, and the ejection systolic murmur is prominent here with a thrill. So symptoms will also seen like breathlessness, nocturnal cough, syncope, and chest pain. You can learn the symptoms by cough, that is clubbing, cyanosis, orthopnea, pulmonary edema, and paroxysmal nocturnal dyspnea. There will be cardiac enlargement. Or on the chest X-ray, you will look when you will look at a chest X-ray, you will get marked cardiomegaly. Normally you will get mild, and here you will get marked cardiomegaly and any sort of arrhythmias and chest murmurs, pansystolic murmurs, late systolic, louder ejection systolic murmur, and diastolic murmur, which is associated with thrill. And the normally the diastolic murmur is transient in nature, but here in the heart diseases it is maybe it is a permanent type of thing. Okay, any arrhythmias. Okay, now coming to the one more thing, that on electrocardiography, that is ECG, you will get normally you will get LAD, that is left axis deviation. Here you will get T wave inversion by atrial enlargements and dysrhythmias. Okay, substructural abnormalities can be seen with echocardio like ASG or maybe VSG, some valve anatomy problems, and ejection fraction may be less. Okay, so JVP will increase, systolic and diastolic with thrill. S4 sounds can be easily heard, and S2 is louder and with a prominent split. On the chest X-ray, you will get marked cardiomegaly. Okay, you will get marked cardiomegaly, and any sort of arrhythmias can be observed easily during a type of heart diseases during pregnancy. Now, the most common heart disease, valvular heart disease, note the word valvular heart disease in pregnancy, is mitral stenosis. So, the mitral valve is the most common associated valve with having the problems in the heart diseases during pregnancy. So, most common valvular heart disease during pregnancy is mitral stenosis. Most common heart disease in pregnancy is mitral stenosis, and a most common heart disease in pregnancy in the developing countries. Note the word most common cause of heart disease in pregnancy developing countries, that is most common cause of mitral stenosis will be rheumatic heart disease in developing countries, and in the developed countries it is ASD, that is atrial septal defect. Atrial septal defect is the most common cause of heart disease in pregnancy in the developed countries. Now, the most common cyanotic heart disease during pregnancy is TOF, and the most common congenital valvular heart disease during pregnancy is mitral valve prolapse. Note the word congenital. In the first point, there is most common valvular heart disease in pregnancy is MS, and the most common congenital valvular is MVP, mitral valve prolapse. Okay, and a most common heart disease which is associated with mortality is mitral stenosis. Okay, it's mitral stenosis. The heart diseases with the best prognosis will be congenital heart disease. So, congenital heart disease is associated with the best prognosis. Okay, it is associated with best prognosis. Now, Clark's classification. Clark's classification has divided into three classes, class 1, 2, and 3, based on the mortality and the diseases associated with that. Okay, so in the class 1, the maternal mortality is less than 1%, and all the congenital heart diseases are included in class 1, as all the congenital heart diseases having best prognosis comparative to other heart diseases. And the class 2nd, maternal mortality is 15 to 25%. In the class 3rd, Clark's classification, the maternal mortality is 25 to 50%, and the diseases which are included in this is primary pulmonary hypertension. Pulmonary hypertension is primary, is the secondary primary pulmonary hypertension, and the secondary one is known as Eisenmenger syndrome, and this Eisenmenger syndrome is associated with the highest maternal mortality. And second one is Marfan syndrome with aortic involvement and a coarctation of aorta. Pregnancy is contraindicated in the Clark's third classes, and MTP is indicated. Okay, so the MTP is medical termination of pregnancy. It is indicated in the heart disease, and the best method for MTP is suction evacuation, which is to be done before 12 weeks. Okay, so the next thing, the pregnancy is contraindicated in some heart diseases, which include severe MS, severe AS. Both are on the left side of heart, so left aortic and left ventricular valves stenosis. Okay, so severe MS and severe AS, ejection fraction when it is less than 30%, and any belongs to NYHA third and fourth class, or Clark's third, which includes the Eisenmenger syndrome, primary pulmonary hypertension, Marfan syndrome with aortic involvement, and coarctation of aorta, all are included in class 3rd. Annie belongs to NYHA class 3rd and 4th. Let's discuss first NYHA classification. Okay, it's NYHA, sorry for my mistake, it's NYHA classification, not NHYA classification. Okay, so this New York Heart Association classification of heart diseases, depending upon the cardiac response to the physical activity. In the grade 1, the patient will have no limitation of physical activity. In the grade 2, there is slightly compromised, light limitations, but the patient are comfortable at rest. And ordinary physical activity causes discomfort. In the class 3rd, the patient is still comfortable at rest. Okay, still comfortable at rest, but discomfort occurs with the less than ordinary activities. In the grade 4, there is at rest, the patient is not comfortable now. The patient have severely compromised physical activity with a discomfort even at rest. This is grade 4th NYHA classification. Okay, so Annie belongs to NYHA class 3rd and 4th. There, the pregnancy is contraindicated, and a patient is advised to go for MTP. MTP is medical termination of pregnancy. Normally, it is allowed till 20 weeks, but here in the heart diseases, it is allowed for up till 12 weeks, and the best method is suction evacuation. Okay. Now the next thing, management. For the management, just learn that the patient is facing discomfort more, will face discomfort more in the supine position. because of the gravid uterus pressure over inferior vena cava. So the patient is advised to take rest in the left lateral position. Take rest in the left lateral position and restrict per vaginal examination to avoid infections, particularly that infective endocarditis. Then IV fluids at 75 ml per hour. Restrict the IV fluid at 75 ml per hour. Why? Because if more fluid is given, if more fluid is given, it will increase the cardiac output, and more cardiac output will lead to heart failure. So restrict the IV fluids at 75 ml per hour. And the best mode of delivery is vaginal delivery. The best mode of delivery is vaginal delivery, and allow the patient to undergo spontaneous labor. Induction of labor is safe, absolutely safe in heart disease patient. Allow the patient to undergo spontaneous labor. The spontaneous labor, okay? Try vaginal delivery. If the second stage of labor is more than 30 minutes, then go for prophylactic use of forceps and vacuum. In between forceps and vacuum, if you are confused, go for vacuum. Why? Because vacuum is prefer because lithotomy position is not needed for vacuum. Okay, and what is it is meant by second stage of labor? Second stage of labor, prolongation in the nulliparous. If the second stage remains for more than 2 hours in nulliparous, and in multiparous, if it remain for more than 1 hour, it denotes that second stage of labor is prolonged. So just go for a prophylactic use of forceps or vacuum. Now, indications of cesarean section in heart disease. So any disease which involves aorta, including aortic aneurysm or aortic stenosis, Marfan syndrome with aorta involvement. So Marfan syndrome with aorta involvement, or coarctation of aorta. Coarctation of aorta. So these are four things. Any heart disease involving aorta, majorly aortic aneurysm, aortic stenosis, Marfan syndrome with aortic involvement, coarctation of aorta. Or if the patient is undergoing emergency valve replacement just after delivery, then cesarean is indicated. Recent MI or CHF, congestive heart failure, if the patient has been fully coagulated on warfarin at the labor or within 2 weeks of labor, then also the patient is advised to undergo cesarean section. Now the anesthesia. The best anesthesia to be used in the patient of heart disease will be epidural anesthesia. Epidural anesthesia is best here. But there are some conditions in which a general anesthesia is used, like in the severe AS, severe AR, pulmonary hypertension. One more thing here, regurgitant lesions are more the patient are more comfortable with the regurgitant lesion than the stenotic lesions. Stenotic lesions are more troublesome. Okay, so severe AS, severe AR, pulmonary hypertension, HOCM, okay, intracardiac shunt. Now the management of third stage of labor in heart disease.